Hello, my dear friends, and welcome. As we age, many of us find ourselves noticing subtle yet concerning changes in how we move through the world. Maybe you felt the need to touch walls or furniture more often as you walk through your home. Perhaps stepping off a curb or walking across uneven ground feels less steady than it once did. These little shifts in confidence, initially easy to dismiss, often signal a deeper concern, gradual but critical losses in our balance. But here's something vital that most people overlook: balance doesn't disappear overnight. More often than not, it's compromised because of simple, preventable mistakes we unknowingly make day after day, year after year. As someone who's walked this journey myself and spent countless hours consulting with experts from esteemed institutions like the Mayo Clinic, Harvard Health Publishing, and the National Institute on Aging, I've discovered something reassuring. These balance problems are entirely avoidable and even reversible. Today we'll explore in depth the 5 most common mistakes causing older adults to lose their balance. Not only will we identify these issues clearly and precisely, but we'll also discuss thoroughly researched practical solutions you can immediately implement to reclaim your independence, confidence, and stability. Throughout this extensive guide, we'll incorporate detailed insights from trusted sources such as AARP Cleveland Clinic and the National Council on Aging. I'll also share real-life stories of individuals I've personally worked with, people just like you who have transformed their lives by addressing these common balance pitfalls. Your ability to move confidently and independently isn't just a convenience, it's essential to maintaining your quality of life, dignity, and happiness. With awareness, knowledge, and proactive steps together, we can significantly enhance your balance and stability, safeguarding your health and independence for years to come. If you find value in our journey today, please don't forget to like, share, and subscribe to our channel. Your engagement truly helps us continue delivering critical health and wellness information specifically tailored for seniors like you. So let's begin our exploration with mistake number 1. Mistake 1. Ignoring foot and ankle strength. Deep dive analysis. When we discuss balance, our minds often jump straight to strength in our core, or perhaps even our inner ear. However, the foundation for balance, literally and figuratively, begins at our feet and ankles. These are the body's primary sensors, stabilizers, and shock absorbers. The importance of feet and ankles in balance medical insights. According to research conducted by the Mayo Clinic and supported by findings from Harvard Health, the feet contain over 100 muscles, tendons, ligaments, and 26 bones. This intricate system works continuously to adjust our posture, stabilize our bodies, and respond instantly to changes in the ground beneath us. Yet, despite their importance, feet and ankles are among the most overlooked aspects of senior health and wellness. One significant issue that contributes to weakening these crucial structures is our modern lifestyle. As noted by the Cleveland Clinic and experts from Senior Planet and AARP community, wearing heavily cushioned shoes and walking mostly on smooth, predictable surfaces like hardwood floors, carpets, or paved sidewalks causes our foot and ankle muscles to become weaker and less responsive. Think of your feet like sensors that continually communicate with your brain, providing vital information about your environment. When we fail to stimulate these sensors regularly, their responsiveness diminishes and our balance naturally deteriorates. Real-life story. George's transformation. Allow me to share with you the inspiring story of George, a vibrant 76-year-old retired teacher. George had always been active, enjoyed gardening, and was proudly independent. But over the past couple of years, he found himself stumbling occasionally, especially on uneven terrain. Initially, he dismissed it as normal aging, yet a deeper issue was quietly developing. When we first met, George expressed frustration. "My eyes are fine, my mind is sharp, but I keep losing my footing. It's unsettling." After conducting a simple ankle mobility test recommended by the National Institute on Aging, I quickly understood George's issue severely restricted ankle mobility and weak foot muscles from years of limited stimulation. To help George, we started him on a simple but scientifically backed regimen. Each day he performed gentle ankle rotations, calf raises, and rolled a tennis ball under his feet to stimulate circulation and responsiveness. Within just a few weeks, George experienced a remarkable turnaround. His balance improved significantly, and he regained the confidence to walk on uneven ground without fear. George told me, smiling, "I never imagined something so simple could make such a difference." Dedder. Practical advice and exercises. Here's how you can apply George's lessons to your own life immediately. Barefoot walking. As recommended by Harvard Health, safely walking barefoot around your home or in the garden on soft surfaces can dramatically improve sensory feedback and muscle strength in your feet. Calf raises and toe raises. The Mayo Clinic advises that these simple exercises done regularly can significantly increase ankle strength and mobility. Simply stand next to sturdy support, lift your heels slowly off the ground, and gently lower them back down. Repeat daily. Foot massage and tennis ball. Rolling a tennis ball beneath each foot not only relieves tension, but also awakens and strengthens the intricate muscles and connective tissues vital for balance. Balance pads and cushions. Using specialized balance pads or even just standing briefly on soft pillows can stimulate ankle and foot muscles, enhancing their ability to respond to instability. Detailed explanation of benefits. Why are these exercises so effective? Research from the National Council on Aging explains that stimulating the foot's nerves and muscles enhances proprioception, our body's awareness of its position in space. By enhancing this proprioceptive ability, our body becomes more adept at adjusting quickly to minor imbalances, significantly reducing the risk of falls. Conclusion to mistake 1. Ignoring the health of our feet and ankles might seem trivial, but as we've learned from experts at Mayo Clinic and Cleveland Clinic, neglecting this foundational aspect of balance can lead to severe consequences. Conversely, simple, consistent actions to stimulate and strengthen your feet and ankles can profoundly enhance your stability, independence, and confidence. As we move forward, I encourage you to integrate these simple exercises into your daily routine. The improvements you'll experience might surprise and delight you just as they did for George. Mistake 2. Avoiding regular balance exercises. Detailed analysis and expert advice. As we discussed earlier, maintaining good balance is not something our bodies simply do on autopilot, especially as we age. It's common for seniors to assume that balance is a given, a natural ability that remains strong unless severely compromised. Yet, like any skill or muscle, balance requires regular practice and purposeful attention to stay sharp. Understanding the complexity of balance. Balance involves a remarkable and intricate coordination between your brain muscles, joints, vision, and the delicate vestibular system in your inner ears. According to extensive research from the National Institute on Aging, NIA, and Harvard Health, when we age without consistently practicing balance activities, this coordination gradually weakens. The result is decreased reflexive responses, increased reaction times, and ultimately diminished stability. Imagine balance as a finely tuned orchestra. Each part, your vision, inner ear muscles, and nervous system, must play together harmoniously. If one or more elements weaken due to inactivity, the entire system suffers. This decline often goes unnoticed until the consequences like falls become apparent. Real-life insight. Linda's wake-up call. Let me share a poignant story about Linda, a delightful woman aged 73, whose journey profoundly illustrates the importance of regular balance practice. Linda, like many of us, believed moving cautiously would naturally keep her safe from falls. She intentionally slowed down, avoided quick movements, and rarely challenged her balance. However, this very caution gradually made her muscles weaker and her nervous system less responsive. During one of our early sessions, I asked Linda to perform a simple test walking heel to toe along a straight line. Linda immediately realized how unsteady she felt, saying to me with genuine surprise, "I didn't realize I'd lost this ability. I thought being careful was helping me, not hurting me." The science behind Linda's situation. Experts from the Cleveland Clinic and the National Council on Aging (NCOA) explain that the nervous system learns and maintains coordination through regular repeated exposure to balance challenges. Without these regular activities, our nerves gradually lose their sharpness, and our muscles forget how to quickly and effectively respond to unexpected shifts in body position. This is precisely what happened to Linda. Recommended balance activities. Proven by science based on extensive studies from Mayo Clinic, Harvard Health, and the National Institute on Aging. Here are scientifically backed exercises and routines specifically tailored for older adults to enhance and maintain balance. 1. Tai Chi. Tai Chi, a gentle martial art involving slow, controlled movements, has consistently been proven through numerous studies, including extensive research published by Harvard Health Publishing, to significantly improve balance in older adults. It strengthens muscles, enhances flexibility, and improves coordination and proprioception, reducing the risk of falls dramatically. 2. Yoga for seniors. Yoga routines, specifically modified for older adults, can safely challenge balance, flexibility, and strength. Organizations like Senior Planet AARP Community highly recommend these gentle yoga sessions to improve overall stability and mental calmness, promoting a holistic approach to aging gracefully. 3. Standing balance drills. Daily simple practices, such as standing on one foot while holding onto a sturdy chair, gradually progressing to hands-free standing, can profoundly improve stability. The Mayo Clinic advises starting with short durations, 10-15 seconds per foot, and incrementally increasing the duration as confidence and ability grow. 4. Heel-to-toe walking tandem. Walking. This straightforward exercise involves walking slowly, placing your heel directly in front of your toe with each step. This method effectively improves balance coordination and strengthens the neural pathways critical for safe and secure walking. Detailed steps to implement balance training. Safely to ensure your safety and gradual progression. Here is a detailed plan for integrating balance exercises into your daily routine. Start slowly. Begin with exercises you can safely perform while holding on to a stable surface. Over time, as you feel more confident, reduce your dependence on supports incrementally. Consistency is key. Short, consistent daily sessions are more effective than irregular, intense workouts. Aim for at least 10-15 minutes of targeted balance practice each day. Track your progress. Maintain a simple diary or log where you note daily exercises and how steady you felt during them. This practice helps reinforce your progress, boosting your motivation. Combine physical and cognitive challenges once comfortable. Combine balance exercises with mental activities like counting backward, reciting poetry, or naming states and capitals. Research from NCOA suggests combining cognitive and physical tasks further sharpens balance abilities by engaging multiple brain regions simultaneously. Overcoming common barriers. Many older adults hesitate to practice balance exercises due to fear of falling or uncertainty about their physical ability. Here's how you can overcome these concerns. Use safety precautions. Always practice balance exercises near a sturdy support or with another person present initially. Gradually build your confidence through incremental successes. Seek professional guidance. If you're unsure or concerned about starting alone, consider joining a class designed specifically for seniors available through local senior centers, community groups, or organizations like Senior Planet. Set realistic goals. Setting achievable short-term goals, such as mastering a 30-second single-leg stand within a month, motivates consistent practice and fosters confidence. Linda's inspiring transformation. Returning to Linda's story, her commitment to daily practice of gentle balance drills led to significant improvements within just a few weeks. She joyfully told me, "I feel stronger, steadier, and far more independent. I wish I had started earlier." Linda's transformation illustrates a powerful truth backed by research: balance is not permanently lost. Regular practice can significantly reverse decline. Summary and encouragement. Avoiding regular balance exercises might seem cautious or safe, but it quietly weakens our physical and neurological systems responsible for maintaining equilibrium. Conversely, making these simple, deliberate balance activities part of your everyday routine can powerfully rebuild strength, coordination, and confidence. Remember, these practices are not only about preventing falls, they're about preserving your independence, enhancing your overall health, and ensuring you remain vibrant and engaged throughout your senior years. Mistake 3. Wearing improper footwear at home. The invisible risk beneath your feet. We often think of balance as something that begins with our brain muscles or inner ear. But in truth, much of our stability starts at ground level with what we wear on our feet. One of the most underappreciated dangers for seniors is inappropriate footwear, especially inside the home. It's an environment that feels safe and familiar, which can make it easy to let our guard down. Many older adults prefer walking barefoot in socks or in floppy slippers. While this may feel more comfortable, it's a silent hazard with potentially life-altering consequences. According to data from the Centers for Disease Control and Prevention (CDC) and insights shared by the Mayo Clinic and Cleveland Clinic, over 50% of falls among seniors happen at home, and footwear is a major contributing factor. Why footwear matters more than you think. Our feet are complex structures. Each contains 26 bones, 33 joints, and over 100 muscles, tendons, and ligaments. They serve as your body's foundation, absorbing shock and adjusting to surfaces. When supported properly, they help the rest of your body stay aligned and balanced. But when unsupported, especially on smooth surfaces like tile, hardwood, or linoleum, they can become a liability. Let's break it down. Bare feet offer no grip and zero protection. Socks alone, or even worse, they turn your feet into skates on polished floors. Slippers with no heel backs. Minimal sole structure or smooth bottoms offer the illusion of safety, but fail to provide the essential stability your aging body needs. Real-world example. Jack's close call. Let me tell you about Jack, a spry 79-year-old who had never once fallen in his adult life until one night he nearly did. Jack got up to use the bathroom, and as he shuffled across the hall in nothing but socks, his foot slipped on the hardwood floor. He barely caught himself on the doorframe. "I didn't even feel like I was doing anything dangerous," he later told me. "I was just walking like I always did." But when we examined his habits more closely, we realized Jack had been skating around his house for years without realizing it. No traction, no support, no shock absorption. Jack made a small change. He invested in proper indoor shoes recommended by Harvard Health Publishing and AARP's Senior Planet. These shoes had non-slip soles, firm arch support, a secure heel counter, adjustable fastenings to keep the foot snug, lightweight design to avoid fatigue. Within a week, Jack reported that he felt more grounded and weirdly even younger when walking. Expert recommendations for home footwear. According to the National Council on Aging NCOA and Cleveland Clinic's Geriatrics Department, proper home footwear should meet the following criteria. 1. Non-slip soles, rubber or textured bottoms that provide grip even on slick flooring. 2. Secure fit, no backless slip-ons. Shoes should fully encase the heel and have adjustable straps or laces. 3. Arch support, especially important for seniors with flat feet or fallen arches. Proper support helps maintain foot structure and reduce fatigue. 4. Low-profile heel. Avoid elevated heels which shift the body's center of gravity forward, increasing fall risk. 5. Lightweight but structured shoes should be easy to lift but not flimsy. The sole should bend at the ball of the foot, not the arch. What to avoid? Let's talk about common footwear that should be avoided at all costs indoors. Floppy slippers. These offer little to no support. If the heel flattens or the shoe slides, easily toss it. Old sneakers with worn soles tread wears down over time, removing the grip your body relies on. If the bottom looks smooth, it's time for a replacement. High-heeled indoor footwear. Yes, it exists. Even small heels increase the forward lean of your body and reduce stability. Socks without traction. If you like to be barefoot or in socks, switch to grip socks, those with rubberized patterns on the soles. Bobber. Alternative solutions. Footwear for specific needs. For swollen feet or arthritis, look for adjustable hook and loop straps, Velcro, and stretchable uppers. Brands like OrthoFeet and Propit make shoes specifically for older adults with foot conditions. For diabetic shoes with extra depth and soft interiors, help avoid friction and ulcers. Medicare often covers these shoes under Part B if prescribed. For fall prevention. Some seniors benefit from light ankle-high shoes that provide more support, recommended by physical therapists specializing in balance rehab. Practical tips for transitioning to safe indoor footwear. 1. Keep shoes at bedside. Many falls occur at night. Having proper shoes within reach avoids the temptation of risky barefoot walks. 2. Replace worn footwear regularly. A good rule of thumb is to inspect soles every 6 months and replace shoes yearly or as needed. 3. Have multiple pairs. One for indoors, one for outdoors, and a backup pair ensures you're never tempted to go barefoot or in socks. 4. Communicate with family or caregivers. Let them know you're making changes for safety. If you have assistants at home, ask them to help monitor shoe condition and fit. Yeager's story of change, how Margie found confidence again. Margie, a 75-year-old grandmother from Pennsylvania, had always worn her favorite fuzzy slippers around the house. But after a minor fall that bruised her hip, she began losing confidence even in her own kitchen. We worked together to explore better options. Margie chose a stylish pair of non-slip indoor shoes with orthopedic insoles. Within a week, she sent me a note that simply read, "I feel like my feet finally learned how to talk to the floor again." Margie's experience isn't unusual. The right footwear doesn't just protect, it empowers. Their final thoughts on mistake number 3. Footwear may seem like a minor detail in the grand scheme of fall prevention, but experts from across the senior care field agree choosing the right shoes is one of the easiest, fastest, and most impactful changes you can make to reduce your fall risk and increase your confidence. So take a moment to look down. Are your feet prepared to support you? If not, now is the time to act. Mistake 4. Over-reliance on furniture and walls. When safety quietly steals your strength. It often starts innocently. You place a hand on the wall while navigating a narrow hallway. You rest your fingers lightly on the countertop as you pass through the kitchen. You keep a hand on the back of a chair just in case. These moments seem smart, cautious, and even wise. And they are at first. But when they become habitual, they start doing the exact opposite of what we intend. They silently undermine our ability to balance on our own. And the longer we depend on external supports like furniture walls, countertops, or even our favorite cane when it's not medically necessary, the more quickly our natural balance system begins to weaken. The physiology of dependence. According to Harvard Health Publishing and expert geriatric physical therapists at Cleveland Clinic, your body contains an entire system designed to keep you upright. Your postural muscles, hips, thighs, calves, core. Your vestibular system, inner ear structures that detect motion and orientation. Your proprioceptive system, nerve receptors in joints and muscles that tell your brain where your body is in space. When you continually rely on a wall or piece of furniture to stabilize yourself, these systems stop working as hard. Your body gets the message, I guess I don't need to react or correct balance anymore. Over time, this leads to muscle weakening, slower reflexes, poor posture, increased fear of falling, greater fall risk. Real-life story. Sarah's slow slide into dependence. Sarah, a 75-year-old retired librarian from Oregon, had always been active. But after a minor fall in her living room, no serious injury, she started reaching for things constantly. It gave me comfort, she told me. I thought I was being smart. At first, it was only when walking at night. Then it became all the time. What she didn't realize was that this seemingly harmless behavior was robbing her of the very muscles she needed to keep her balance naturally. Within 6 months, Sarah said she didn't trust herself to walk from the bedroom to the kitchen without a wall nearby. That's when we intervened. The recovery. A gentle shift in thinking with Sarah. We didn't yank the safety net away. That would have been reckless and frightening. Instead, we used a progressive restoration approach as recommended by the National Institute on Aging NIA and the National Council on Aging NCOA. We created a plan that involved neural practicing short distances unsupported each day, 5 to 10 steps between furniture, standing in place for 30 seconds without touching anything, then increasing time. Practicing heel-to-toe walking near a wall, using it only if needed. Introducing mirror walking, where she walked toward a mirror while maintaining posture and awareness. Gradually reducing her reliance on the cane, transitioning to a walking stick, and then using no support inside her home. The result: within 2 months, Sarah was walking confidently without needing the wall. Her confidence soared. She called it freedom. I forgot I had. Warning signs of over-reliance. You might not even realize how much you're depending on furniture or walls until you pause and observe your movement. Ask yourself, do I automatically reach for walls when I stand or walk? Do I feel anxious or uncertain taking steps without something to hold? Do I avoid spaces with no nearby furniture or support? Have I stopped trying to balance on my own because I'm playing it safe? If you said yes to any of the above, it's not a judgment. It's a signal, a loving nudge to start retraining your body and regaining your confidence. Research-backed exercises to reduce dependence. Experts from Mayo Clinic and Senior Planet AARP recommend the following strategies to restore natural balance and break the furniture habit. 1. Wall proximity practice. Stand close to a wall but avoid touching it. Practice shifting your weight side to side, forward and back, using your muscles, not your hands, for balance. 2. Sit to stand repetitions. Sit in a sturdy chair and rise to stand without using your hands. This strengthens legs and improves proprioception. Try 5-10 reps twice a day. 3. Corner standing. Stand with your back in the corner of a room, 2 walls behind you, nothing in front. Practice standing with feet close together and eyes open for 30 seconds. Once confident, try it with eyes closed for brief moments. 4. Footwork drills. Practice stepping side to side, forward, back, and in a small circle. These movements challenge your natural balance and improve reaction times. 5. Confidence walks. Choose a room with a clear path. Walk from one side to the other without touching anything. Track how far you can go each day and celebrate even small progress. Backstage psychological benefits of reclaiming your balance. It's not just about the physical. Research from the Cleveland Clinic shows that restoring independent balance leads to improved self-esteem, lowered anxiety and fear of falling, increased willingness to socialize and participate in activities, reduced risk of depression. When you rely less on your surroundings and more on your own ability, you send your brain a powerful message: I can handle this. When support is still necessary. Of course, there are times when canes, walkers, or furniture are essential, especially after surgery, during illness, or when medically advised. We're not advocating recklessness. What we are saying is this: don't let temporary support become a permanent crutch if you don't need it. Relearning to trust your body gently and progressively is one of the greatest gifts you can give yourself in your later years. Tucker T-shirt. Go final thoughts on mistake. Number 4. The comfort of touching a wall or countertop is understandable, but over time that comfort becomes a trap, one that weakens your body and erodes your natural reflexes. With patience, gentle practice, and the right guidance, you can regain that balance both literally and emotionally. Sarah did it, and so can you. Mistake 5. Ignoring vision and inner ear health. The silent systems that shape your balance. Most people think of balance as a matter of strong legs or a stable gait, and while muscles play a role, they are just one piece of the puzzle. 2 systems, often taken for granted, form the hidden foundation of our ability to stand, move, and respond quickly to the world around us. 1. Our eyes' visual system. 2. Our inner ear's vestibular system. When these systems start to weaken, and that often happens gradually as we age, they don't always trigger obvious symptoms right away. But their deterioration can quietly, insidiously sabotage your ability to remain steady. Let's take a closer look at how they work, how aging affects them, and what you can do starting today to protect and restore them. How vision affects. Balance your eyes do more than help you see. They provide your brain with constant information about where you are in space. According to Harvard Health Publishing and the Mayo Clinic, your visual system plays a key role in detecting changes in elevation like steps or curbs, objects in your peripheral field to help avoid obstacles. Shifts in lighting, for example, moving from a bright room to a dim hallway. Contrast and depth, so you can judge how far to step or reach. When these inputs are blurred, delayed, or distorted, your brain can no longer make precise decisions about how to move your body safely. Age-related vision changes that impact balance. As we age, the following changes are common and all affect balance. Reduced visual acuity. Things just aren't as sharp as they used to be. Declining contrast sensitivity makes it harder to distinguish a step edge or rug corner. Poor depth perception. You might misjudge how far away the ground is. Loss of peripheral vision makes it easier to bump into furniture or miss nearby hazards. Slower light adaptation. Walking from bright daylight into a dim room may leave you blind for several seconds. These changes might seem minor at first, but over time they become one of the top contributors to falls in older adults. Real-life case. Tom's mysterious instability. Tom, an 80-year-old former tennis coach, prided himself on staying active. But lately he found himself stumbling, especially in unfamiliar environments or when walking in low light. "I thought I was just slowing down," he told me. But something didn't feel right. I couldn't see small changes in the ground. I was tripping on things that never used to bother me. After a visit to his optometrist and a full geriatric balance assessment, several issues came to light. He had early-stage cataracts that blurred his depth perception. His eyeglass prescription hadn't been updated in 4 years. He had slight macular degeneration which affected contrast. The fixes were surprisingly simple: new, properly calibrated glasses, cataract surgery a few months later, enhanced home lighting, especially nightlights in hallways. Tom's balance improved dramatically. "It was like someone cleaned the windshield on my life," he said. Inner ear and vestibular health, your hidden gyroscope. While your eyes tell your brain what's happening around you, your inner ears tell your brain what's happening inside your head, like when you tilt, turn, or move. Your vestibular system is a delicate set of fluid-filled canals and hair-like sensors inside your inner ear. These sensors detect motion, orientation, and gravity. They tell your brain whether you're upright or tilted, if you're turning left or right, if you're falling or rising. As the Cleveland Clinic explains, when these sensors degrade, which they often do with age, your brain starts receiving incomplete or confusing information. This can cause dizziness. Poor coordination. Slow reaction time, a feeling of floating or being off balance. Difficulty walking in the dark or on uneven surfaces. Most common vestibular disorders in seniors. 1. Benign paroxysmal positional vertigo, BPPV, one of the most common inner ear conditions. It causes sudden spinning sensations, often triggered by turning your head. 2. Labyrinthitis or vestibular neuritis. Inflammation in the inner ear due to a virus can cause dizziness, nausea, and imbalance. 3. Meniere's disease, a chronic condition involving pressure and fluid buildup in the inner ear leading to episodes of vertigo and hearing loss. All of these conditions are treatable, but only if diagnosed. Through debugging signs, you should get checked. If you experience any of the following, you should speak with your doctor or a balance specialist. Frequent tripping or stumbling, especially in low light. Sensitivity to moving crowds or busy environments. Sudden dizziness, especially when changing head position. Feeling like the ground is shifting or you're walking on a boat. Trouble judging distances or step height. Needing to touch walls in dim environments. According to the National Institute on Aging, these signs are not just part of getting old. They're medical clues, and when addressed, they can restore balance and confidence. Few practical solutions to protect your vision and vestibular health. 1. Regular eye exams. Have your vision checked at least once a year. Request a comprehensive exam, not just a vision screening. Ask about the cataracts, glaucoma, macular degeneration, updated prescriptions for glasses. 2. Improve lighting at home. Install brighter overhead lights and night lights. Use motion sensors for bathrooms and hallways. Add contrast tape to steps and floor transitions. 3. Vestibular Rehabilitation Therapy, VRT. This is a physical therapy program designed to retrain your brain and body to adapt to inner ear changes. Proven effective for BPPV, vestibular loss, and balance disorders. 4. Consider hearing aids. Many seniors don't realize that hearing and balance are closely connected. According to studies published by Harvard Health, hearing aids have been shown to improve balance in people with hearing loss. 5. Avoid quick head movements. Until a vestibular condition is diagnosed and treated, move slowly when turning your head or changing position. Use caution when looking up, down, or turning over in bed. Story of hope. Eleanor's second chance. Eleanor, an 84-year-old widow, had resigned herself to just getting old. She had fallen twice in the past year and began staying home, more afraid of what might happen again. After a referral from her primary doctor, Eleanor underwent both a vision exam and a vestibular evaluation. The diagnosis: outdated trifocal glasses, mild BPPV. The solution: new glasses with better depth correction. Simple VRT exercises at home. In just 6 weeks, Eleanor was back to walking around her neighborhood cane-free with confidence she hadn't felt in years. Final thoughts on mistake. It's easy to overlook the importance of our eyes and ears in maintaining balance. After all, we associate movement with legs, not sight and sound. But ignoring these systems robs your brain of the vital information it needs to keep you steady. Thankfully, most of the common issues affecting vision and vestibular health are highly treatable. By being proactive, getting your eyes and ears checked, upgrading lighting at home, and practicing vestibular-safe movements, you can take control of your balance and reclaim your confidence. Final reflections. Small changes. Steady steps. Safer lives. You are not fragile. You are capable. Dear friend, if you've stayed with me through this long and meaningful conversation, I want to acknowledge something important. You care deeply about your health. You value your independence. And most of all, you still believe that growth, change, and strength are possible at any age. And you're absolutely right. Aging may bring challenges, but it also brings wisdom, clarity, and the opportunity to make smarter choices based on what we've learned through life. Let's take a moment to reflect on what we've uncovered. Of the 5 balance-stealing mistakes, we must avoid 1. Neglecting foot and ankle strength. We learned how our balance begins at the feet. George's story taught us that even years of inactivity can be reversed through simple daily exercises. The solution: barefoot movement, tennis ball rolling, calf raises, and mindful walking. 2. Avoiding regular balance training. Linda reminded us that playing it too safe can backfire. Balance-like memory fades when not used. The solution: gentle daily drills, heel-to-toe walking, standing on one foot, and Tai Chi. 3. Wearing improper footwear at home. Jack's near fall in socks was a wake-up call. Home comfort shouldn't mean high risk. The solution: Supportive non-slip, fully enclosed shoes with firm soles and grip. 4. Over-reliance on furniture and walls. Sarah showed us how small acts of dependence can lead to muscle loss and fear. The solution. Gradual reconditioning, standing unaided, walking short distances unsupported, and rebuilding confidence through movement. 5. Neglecting vision and inner ear. Health Tom and Eleanor reminded us that balance isn't only about muscles, it's about what your brain sees and hears. The solution. Yearly eye exams, treating ear issues, vestibular rehab, better lighting, and hearing aids when needed. What this really means for you. Balance isn't just about avoiding falls, it's about reaching the pantry shelf without hesitation, strolling through the park without fear, dancing with your spouse in the kitchen, holding your grandchild without worrying about stumbling, waking up each morning knowing you can move through your home with grace, steadiness, and pride. These things matter. Not just physically, but emotionally, socially, mentally. Give the truth you deserve to hear. You're not too old to get stronger. Muscles respond to use even in your 70s, 80s, and 90s. Nerves can rewire, reflexes can return, vision and hearing can be corrected. Confidence can be rebuilt. No matter where you're starting from, there is always a next step you can take. So, what can you do right now? Here's a simple plan for the next 7 days. Day 1, check your footwear. Replace anything slippery, worn, or unsupportive. Day 2, try standing on one foot for 10 seconds. Do it near a counter. Switch feet. Day 3, roll a tennis ball under your feet for 2 minutes. Day 4, walk heel to toe down your hallway. Day 5, remove trip hazards, rugs, cords, clutter from your main walking paths. Day 6, schedule a vision exam. Ask specifically about contrast and depth. Day 7, take a short, unsupported walk inside your home. Count your steps, be proud, then repeat. Keep going. You'll be amazed at what small, consistent habits can do. Let's walk this path together. I created this video because I believe in you. I've seen too many wonderful, intelligent, independent people give up their freedom not because they had to, but because no one told them they had options. That change was possible. That strength could be reclaimed. If this video has helped you in any way, please like this video so more seniors can find it. Share it with a friend, neighbor, or loved one who needs this message. Subscribe to this channel and turn on the notification bell because we'll continue sharing real, trustworthy health and lifestyle guidance just for you. Your support helps us build a strong, connected community of older adults committed to vibrant aging. Final words of encouragement: balance is not a luxury, it's your birthright. And no matter how old you are, no matter how long you felt unsteady, you can take control. You can strengthen your body. You can restore your confidence. All it takes is the first step. So take it today, because the ground beneath your feet, it's waiting for you to stand tall again. Thank you for spending this time with me. I'm honored to walk beside you on this journey. Until next time, stay strong, stay steady, and above all, stay hopeful. See you soon.